My name is Jace Snow, and I want to give a brief overview of my Capstone project idea. The idea that I have is to create a website called the Value Base, and what this website will do is it will help instruct and teach health systems how to implement value-based healthcare concepts. So back with the ACA and its implementation, the CMS created an incentive program for health systems to implement value-based healthcare. So it's been a long time since that incentive program was created. However, most health systems in the United States have reported that they have not transitioned to value-based healthcare, and it's not because they don't want to, it's more of they don't know how to. So even though the Centers for Medicare and Medicaid Services has created an incentive program for health systems to change, they have not created a program to teach them to change. Now, there are some private corporations or private organizations that have trainings, but they just haven't been successful, and I think it's because they're not using success stories and already in place data from major health organizations such as Kaiser Permanente and Intermountain Healthcare. So these are just two examples of major health organizations that have implemented value-based healthcare, and I think if we create an incentive program for them to share their data with us, then we can then take that data and create training implementation models and have health systems subscribe to our website, and then they can have complete access to this data and learn how to implement value-based healthcare concepts. And then once they implement those value-based healthcare concepts, they can take advantage of the CMS's incentive program. And the reason why this is such a needed thing is right now we are a vastly volume-based healthcare system, and with that there can be considered a lot of wasteful spending with all of the tests and procedures and services that physicians do that may or may not benefit the patient. But with value-based healthcare, the patient is the center of all healthcare services, and so patient health outcomes are number one. And if physicians are focusing specifically on patient health outcomes, then we should see patients getting healthier. And if patients are getting healthier, then they don't have to use health services as often. And so with this value-based healthcare implementation across the United States, we should see a vast reduction in healthcare spending. And there's still a way for physicians and health systems to be compensated fairly, but we just need to make sure that patients are getting healthier first. That's got to be our focus. And so the value base, or my website, will fill the gap that health systems are feeling with implementing value-based healthcare. So we're going to teach them how to do it, and then they can take advantage of CMS's incentive program, and then everybody wins because we should see a vast reduction in healthcare spending.